So what we've tried to do in our vanguard was to develop new care models that would join up services around communities in Morecambe Bay. Morecambe Bay is a very dispersed area. We have some small towns, but we also have the Lake District and large travelling distances in between. And there are differences between the communities.
We have a deprived area in Morecambe and in Barrow, and the trust spans more than 50 miles from one side to the other, with 4 hospitals involved and quite a lot of care that needs quite a lot of different thinking regarding delivery.
3 years on, what we're able to say now in Morecambe Bay are a whole series of really positive stories about how our new care model has developed.
We have been working very hard to form an integrated care community. Integrated care community basically means that we are not working in isolation as a healthcare deliverer anymore. We're starting to work with other organisations like our acute trust, our community provider, our social services, our police force, our fire brigade, our third sector voluntary agency, and of course our patients, trying to provide care for our patient population in a very different, much more proactive rather than reactive way.
Once a month we had a multidisciplinary meeting where we invited people from the ICC to offer ideas and support on how to improve things for that particular family.
Overall, there have been challenges with the approach. There's a sense that you're beginning to lose control. In other words, the control is being passed more to primary care and to the patient, and you're not. And you have to be able to trust the patient and your primary care colleagues to recognise when there's a problem, when you're the expert.
We've also used technology to re-establish better communication between GPs and hospital consultants. That means that in many cases we can create a flow of information between the GP and the consultant so that patients don't need to go for a hospital appointment. That saves time and travel and resources.
So we've pushed quite hard on real-time sharing so that within the hospital they can see the GP record and they can see extensive parts of the GP record. We've pushed on community services, being able to see the GP record and vice versa, and that's been quite important.
And there's actually much closer interaction between us and primary care, and so that wall has actually been broken down. So the primary care and us talk to each other all the time, and they're very much part of what might be called a virtual MDT.
And in terms of women and children's services, professionals there have found ways in which, by providing the right advice to people at an earlier stage, again, children don't need to come into hospital.
Some of the things we did was provide education for the parents and the child about their condition, or just general advice and support. For example, directing families to what to do when the child has a temperature, or simple things like constipation. So we set up some groups to provide that.
The work that we've done locally on our strategy and the connection to the Vanguard programme was to build those new care models, but make them as tailored as we can to the needs of their communities.
We've seen the results already. The Morecambe Bay Vanguard is performing very well for non-elective admissions, so those emergency admissions, we've cut those, and I think we're still significantly ahead of the pack in performance terms.
The advice I would give is, first of all, trust your GPs. Make sure that the education infrastructure is there, not just for the patients, but for the GPs, and make sure that there's enough publicity about using that approach.
We've seen some phenomenal conversations develop here in Morecambe Bay. The community are really galvanised. People are hugely engaging in the conversations. And what happens is you never know the potential of just bringing people together to talk and to find each other, to encounter someone who's completely different to them, and then see what sparks out of that and becomes a movement for change.
I think it takes an awful lot of effective partnership work. So a sense of a common purpose or a commitment to a common plan, I think that makes it much more likely that you will succeed. And I think in Morecambe Bay, we've had a sense that we could only take the system as a whole forward if we were prepared to work together. And I think that would be the story of Better Care Together. It's the together bit in Better Care Together.